endometriosis pain it's been a long time coming. Things have been brewing for a long time. Everybody always wants a quick fix, one quick fix, but even one good thing, even if it's really good, is usually not enough to calm things down. So that's why stress multi. So you can get help from injections. Injections can be restorative, create space around the nerves, decrease that nerve inflammation, increase the blood flow to the area, and help the nerves to reset so we can repetitively desensitize the nerve. It's like rebooting a computer that's frozen. And that way, the nerves can start to function properly again, too. Injections can also help the muscles to relax, help break that cycle fast. As far as medication, I typically like to use a combination of muscle relaxers, nerve pain medications, better when it's in the suppository form. And why is because when it's suppository, it gets to the space better. It's more localized and it doesn't cause a lot of systemic effects. So if you were to take those medications orally, you would get maybe some side effects, but not so much when you do it as a suppository. As far as oral medications, so something super important that happens to any patient that has chronic pain at all, when you have pain longer than 3 to 6 months, the way your pain processing it changes. The way your receives the pain, it becomes more amplified. A big example of that is when I'm barely touching patients and they're like jumping off the table, and that's because their nervous system is kicked up. So sometimes I treat that with oral medications, even just temporarily, even low dose. Natural things that can help with sensitization are meditation and movement meditation like yoga. Diet. So there are some dietary changes that you can do. Go for an anti-inflammatory food and medicine, right? So less inflammation in our food means less inflammation in our body, means less pain. So trying to avoid things like dairy, gluten, excessive alcohol, excessive sugar, fried fatty foods, anything. Doesn't mean you have to cut it out completely, but just trying to minimize them. And understanding that when you do have some of the foods, maybe it might flare you up a little bit. Lastly, and super important, all of my patients get pelvic floor physical therapy. And we'll transition on to Inez.